Okay, this is chapter 2, review for CNA. A resident's chest pain is an example of something that a nurse assistant should report immediately. True or false?
True.
In healthcare, the most common way to get a blood-borne disease is by contact with infectious blood or bodily fluids. Oral reports are one type of verbal communication. Well, we talked about two types, oral and written. They're all verbal. Nursing assistants should use medical terms to explain a resident's condition to their family. False. You want to use smaller terms. Nursing assistants should use the face of an imaginary clock to explain the position of objects to the residents with vision impairment. Nursing assistants should give medical advice.
False.
People who are mentally ill cannot simply choose to be well. If a resident tries to hit a nursing assistant, the nurse assistant should try to block the blow or step out of the way. The wider the base of support, the more stable a person is. Answering call lights immediately is one way to help prevent falls. The best help prevent burns, place hot drinks on the edge of tables. Early treatment for a suspected stroke may help reduce the severity of the stroke. True, fast as you can. Gloves need to be worn when a nurse assistant is shaving a resident. Washing hands has no effect on preventing the spread of disease. Disposable gloves can be worn 3 times or more. The best way to control the spread of MRSA infections is through proper hand washing. True. When a person is choking, what do they normally do? Hands to the throat. We talked about this. I don't know if you caught it. I think we did. When a resident is believed to be having a heart attack, what's one thing that we are going to do for the patient? One thing that we can do. Good idea. But in the beginning, first of all, put your gloves on, notify the nurse, and then what can we do? Unloosen. Because they may be breathing really hard in a minute. I mean, literally breathing really hard. Or they may need to intubate them, but loosen them for them. During which of the following tasks does a nurse assistant need to wear gloves? Brushing a resident's hair, hugging a resident, giving mouth care, walking with the resident.
C.
What was C?
Giving
Mouth care. When a resident is having a seizure, the nurse assistant should try to restrain the resident, give the resident liquids, lower the resident to the floor and have someone call the nurse, put a towel in the resident's mouth.
Lower resident.
Lower them to the floor. Which of the following statements is an example of using good body mechanics? Spreading feet shoulder width apart when lifting, bending at the waist, twisting when moving, holding objects far away from your body. Spreading feet shoulder width apart. When communicating with a resident who has hearing impairment, the nurse assistant should approach the resident from behind, remove the resident's hearing aid, use short sentences and simple words, talk more loudly than normal. Not talking more loudly. Short sentences, simple words. Though you think that would be your answer, but that's on a test. Use short sentences, simple words, so they can understand you. You don't want to get louder, because I know what happens. They can be like, huh, and then you say it again, and huh, and then you say it again. But if you just slow it down a little bit, slow it down a little bit, and maybe a little clearer, or shorten it, and they should be able to hear you. Hopefully. Lower your tone of voice. Which of the following is true about hand washing? A nurse assistant should only wash their hands before, not after contact with the residents. When washing hands, arms should be angled upward with the hands higher than the elbows. We didn't talk about that. Washing hands should not be done after touching bodily substances. Washing hands is the most important thing a nurse assistant can do to prevent the spread of disease. Most important thing. Where should your hands be?
Down.
You don't wash your hands like this. I see a lot of people, pick up their hands out the sink, do all this, but you're allowing it to get back on you. You wash down. What's BP stand for? Blood pressure. CVA. CVA.
Is it cardiovascular or something?
CV.
Oh,
Oh.
Cerebrovascular.
Get those right, because this what everybody does that. They go exactly to cardiovascular.
Yeah.
It's cerebrovascular disease. Cerebro, it's your brain. CVA is a stroke, and y'all need to go straight to your brain. Cerebellum is in your brain. Cerebrovascular accident. Put all that together, and that'll get you back to CVA. Because a lot of people want to do the cardio.
That's what I was thinking, cardiovascular. I was like,
PPE. What? Personal protective equipment. T. She getting fancy. You're gonna have this on your sheet. It's gonna be TPRBP. What's the T stand for? TPRBP. You're not gonna find that whole list there. Somebody that's been working. One of y'all. Mm-hmm. Somebody, they give you a sheet of paper. It has T on the top, P, R on the top, and BP. There you go. Temp, pulse, respiration, blood pressure. Oh, they're gonna hand you a sheet that says that. They're not gonna say, oh, they just sit it there. We know to get our body signs. TPRBP. And that's how you wanna record it too. Most people record it in that order, so we'll know what it is. But I wouldn't think, like if the pulse was 98, I would not think that was the respirations. I would hope not. So most people match the numbers to it. But TPRBP is mostly how you record. FF. FF. Forced fluids. And DNR. Did not resuscitate. Yes. Now, this is what I want you to choose from. Is this airborne, droplet, contact, or standard precautions? Okay. Comprehensive infection control system for reducing the risk of contracting infectious diseases used on every patient in a nurse assistant's care. Airborne, droplet, contact, or standard? Standard. Everybody. That's that magic word for standard precautions. Everybody. You're using that on everybody. Precautions used for diseases that can be transmitted through the air. Yes. Precautions used when the disease-causing microorganism doesn't stay suspended in the air and usually travels only a short distance after being expelled. Comes in and expels. Precautions used when a resident is at risk of transmitting or contracting a microorganism from touching an infected object or person. See it. Air is airborne. Contact. Travels a short distance and drops. Drop it. And on everybody, standard.